Today is the Great American Smokeout, a holiday of sorts organized by the American Cancer Society as a day to start the journey toward a smoke-free life. But for many, that's easier said than done. One man who did shares his story in today's MedWatch report.
I'm progressing, and finally, to this day, I work out probably 4 to 5 times a week. I'm up to 2.5 miles a day sometimes.
These are big steps for Michael Hannenberg. He has chronic obstructive pulmonary disease, or COPD. He will never have more than 30% lung capacity. That's after smoking for much of his life.
Thought it was cool back then, but it's not cool. And my parents smoked. In fact, my dad passed to lung cancer, so that's when I should have quit. But smoked teenage and all the way up to 57.
It took a very personal scare to get Michael to finally kick the habit.
They said right away my oxygen level was really low, so they rushed me right to emergency, and from emergency they put the breathing tube down me, and it was pretty bad. I was on my way out.
He spent 8 days in the hospital. 6 of them were in intensive care. It literally changed his life.
I got out of the hospital and then started doing programs and started maintaining. And for 3 years now, I've been smoke-free over 3 years and kind of feel more healthier than I've ever been besides the breathing part.
But up until this point, Michael has been lucky. He stayed cancer-free.
Lung cancer is the 3rd most common cancer, but it's actually the leading cause of cancer deaths in the United States. So more people die each year from lung cancer than the 3 next cancers: prostate cancer, breast cancer, and colon cancer combined.
And there's a very specific reason for that.
The majority of lung cancer is actually diagnosed at a later stage, which contributes to that higher mortality. And researchers have been trying for years to figure out a way to diagnose lung cancer earlier so we can treat it better.
That's why radiologist Patrick Gartland started Munson Medical Center's lung cancer screening program in 2015. There are several facets from the actual test.
We realized that we can perform low-dose CTs of the chest where we're reducing the risks of the radiation, but still maintaining the sensitivity to be able to detect early lung cancers.
You may breathe normally.
To trying to get to the root of the problem.
One of the integral parts of this program is counseling the patients on smoking cessation and having those resources available.
While this grandfather has already taken that first step of quitting.
I don't want to go away right now. You know what I mean? I got kids, I got grandkids, and someday hopefully great grandkids. You know, I'm just going to do what I can to stay alive.
He also plans to get the lung cancer screening while trying to encourage others who smoke to stop.
I'm sure they know they want to quit, and I was there. I even have my children smoke, so it's kind of a... And, you know, lung cancer is hereditary, too. And another thing, I think my next step is to get screened for lung cancer.
For MedWatch, I'm Michelle Dunaway.